It is Stroke Awareness Month, and 80% of these medical emergencies are actually preventable.
Yeah, experts say it's important for everyone to recognize the signs because it can happen to anyone at any age. Well, joining us now in studio, Dr. Nour. Dr. Nour is a vascular neurologist with UCLA Health. Good morning, doctor.
Good morning to you.
We appreciate you being here because this is certainly an important topic. First and foremost, explain to everyone out there what a stroke is and how we can recognize the signs.
Absolutely. That's such an important question. Stroke is where there's sometimes lack of blood flow to the tissue of the brain. By doing so, the brain tissue can't function. So if that brain tissue is responsible for our strength, then we lose our strength, or our vision, then we lose our vision, or our language, then we lose that. Also, there's a type of stroke where there's bleeding into the tissue of the brain. It's really important to recognize the signs and symptoms, so I want to give the audience something to remember it by, and it's B fast or fast.
Okay.
B stands for sudden changes in balance. E stands for sudden changes in vision.
Eyes.
Eyes, exactly. F for sudden changes in your face. So weakness in the face or a drooping of the face.
Like a paralysis,
Like a paralysis,
right? Yeah.
exactly. And A stands for weakness in either the arm or leg. S stands for changes in speech or language, and T is time to call 911. That's the most critical thing, and the most critical message is not only to recognize the signs and symptoms, but not to wait, to just immediately call 911, because stroke is a time-sensitive emergency.
Absolutely.
For every minute that passes, 2 million brain cells die.
Wow.
Every minute.
Every minute.
So you recognize this in yourself or someone else. Is there anything you should be doing in the time you're waiting for 911 to arrive?
Nothing other than to make sure they're safe, prepare their medications. That's something really important that the paramedics will ask. And then understand when were they last seen normal. We always ask, when were they last seen well? When were they last seen normal? Why is that important? Because medications are critical to give within certain time windows. So knowing the last known well time and knowing their medications is really critical.
Absolutely. Dr. Nour, you're the medical director of the UCLA Mobile Stroke Unit, which is the first of its kind here in California. How amazing is this? Explain to us how important is this program? And I understand it's also expanding.
Absolutely. So like we talked about, what's important in stroke is recognition and time. So the Mobile Stroke Unit is a primary stroke center on wheels. We bring the hospital to the patient.
Oh, wow.
So imagine we save precious minutes, up to 30 and 40 minutes faster to give treatments than if the patient went directly to the hospital. Of course, our hospitals are fantastic and they're equipped with everything we need, but the Mobile Stroke Unit brings that hospital to the patient. We have a CT scanner inside of the ambulance. We can do the CT scan, determine if it's a bleeding type stroke or lack of blood flow stroke, and immediately administer brain and life-saving medications.
That time can save a life.
Can save a life. And then we take them to the most appropriate hospital. We are a shared regional resource of Los Angeles County EMS, so we're non-denominational. We drop off patients at all stroke centers across the county, and with the support of Supervisor Janice Hahn and the County Board of Supervisors and philanthropy, we're able to expand now from 1 unit to 3 units within our county. So I'm very proud of that.
Congratulations.
Yeah, that is absolutely life-changing.
Thank you.
Tell us who is most at risk for a stroke. When we talk about age, lifestyle, what puts you at risk for a stroke?
So everybody has a different risk, sets of risks. And there are some important risks like having high blood pressure, high cholesterol, and having obesity, inactive lifestyle, smoking, illicit drugs, and atrial fibrillation, which is an irregular heart rhythm. Sometimes older populations will have more atrial fibrillation. So depending on your risk, it's really important to work with your primary care physician to mitigate these risks, to be on the appropriate medications to reduce the risk of stroke.
Such good information. And Dr. Nour, thank you so much for being here and just telling us this, information that we all need to know, not only for ourselves, but for our loved ones around us, right? We recognize the signs, and that acronym is great.
Yes.
Be fast.
Absolutely.
We'll keep that in mind.
Conversations like these definitely save lives. Dr. Nour, thank you for being with us.
My pleasure. Thank you.